I'm a national coordinator for the Physicians for National Health Program, which is headquartered in Chicago. And I ended 60 years of medical practice a year ago to do this full time. It's a pleasure to be in the Bay Area for this remarkable demonstration.
So what are your thoughts about where things stand now with single payer? It seems that Congress and Obama are not providing very much space for discussion of it.
That's absolutely right. And we think we're at a peak of our strength. Over the past 20 years I've been in this activity, and we've never been stronger. We have expressions of single payer support all across the nation, not just the big metropolises of this country. We have a big movement in Montana where Senator Baucus comes from, and he's heard from a lot of doctors and just plain folks in Montana demanding single payer. And right now the demand is to be in the debate. Remarkably, the legislators starting from the premise that we can't win, we don't have the votes, therefore we shan't discuss it. That is about as anti-democratic as you can get in a society like ours. We think that the public demand for single payer is more and more clear-headed and articulate. The labor movement is finally waking up. Even elements in business see that their future financial success depends on having reasonable health insurance costs, and that's what single payer is. So I'm cautiously optimistic. We had to have a demonstration at the Senate hearing in D.C. because we literally weren't being allowed to present. Our people were arrested. It was nonviolent resistance, civil disobedience, if you please. And there are 13 people who have been arrested, but they've opened the door, and these congressional leaders are saying they'd like to talk to us now. That's step one of a very important path.
This legislation is going to start to be written in the next few days or weeks. Can we break through in time to get single payer to be discussed?
I think the answer to that is yes. I think there's going to be more and more expression from the public. For example, the legislative leaders have said we will be able to brief the chair of the several committees that are covering this. I wish our strength were greater. I can't represent that we have enough to win, but I certainly think we will get into debate. And as the public becomes aware of what's going on, and that the problem is the huge contributions of the industry, meaning the health insurance people, the big pharma, all these elements are pouring money into the Congress. And our society can't tolerate a Congress that can be purchased in this way. So I think that works for us.
One last question. What would you advise someone watching you today to do? We're talking on May 29th, 2009. What can we do in the next few days to help single payer break through?
We think that nationwide the answer is visitation to your congressperson wherever they stand. If they're for single payer, and hundreds are, and you must tell them we support them and they should be bold. And if they don't support it, you should make the strongest case for why they should and how important it is not only to our nation's health, but to our nation's economy. Visitation to your congressman in the district, they're recessed now, that's the way to go.
Thank you very much, Dr. Young.
My pleasure.